morning.
Good morning, Dr. B.
We're very privileged this morning to have Dr. Penny Montgomery here with us on our morning show. So, Dr. Montgomery has been in the field of biofeedback and neurofeedback for a long time. So, could you tell us a little bit about how you got involved in this area of science?
Well, I was working as a research associate at the University of Texas Medical School at San Antonio, and this was back in about 1969. And we had an opportunity to meet with an individual who was working on ways to train the brain, and it became known as the field of neurofeedback. And so I've actually been involved with neurofeedback, with the study and training of brains for more than 44 years now.
Wow. So could you help it? A lot of people get confused about different kind of methods. Could you just explain a little bit about what neurofeedback is?
Sure. Neurofeedback is actually training. It's not treatment, but it is training. And it's a method by which we can train the brain to reestablish more normal functioning. And we do that by training the brain to inhibit frequencies that are not efficient for the task. When a neuron fires, it fires a lot of different frequencies, and then the inhibitory neurons come along very rapidly and sort those out by inhibiting frequencies that aren't appropriate for the task. And when a brain is damaged or when it's injured, it has a tendency to have this inhibition process fail. So we see frequencies and patterns in the EEG that should not be there. So we determine which frequency band those patterns that should not be there are in, and we train the brain to inhibit those frequencies. So we're really just reestablishing a good inhibition process in the brain. It's like the brain would heal itself if it could. And the only reason it can't is because it doesn't have the required information. And that's what the biofeedback machine provides.
Well, that's very interesting. So what kind of conditions would people be interested in utilizing neurofeedback? What can neurofeedback really help with?
Well, it can help with almost any condition where the brain is firing abnormally. And so that takes in a whole bunch of different conditions. And people wonder why neurofeedback is helpful in so many different conditions. And the answer is because it helps correct misfiring in the brain. If there's misfiring in the frontal lobe, for example, you may have poor impulse control or symptoms of attention deficit disorder. If you have abnormal firing in the back of the head, you can have vision problems, hearing problems, difficulty sleeping, addictive disorders. So considering that the brain has a lot of different specialties, different parts of the brain have specific specialties, but of course it must all work together. When there is an area of the brain that's misfiring, it can't work together, so we see symptoms. And so we really don't do diagnoses per se of a particular disorder, but rather we look at where is the abnormal firing pattern and what is the abnormal firing pattern, and train the brain to correct that, and symptoms of many diagnoses are helped.
So if a person was interested in neurofeedback, what is the initial evaluation like? How do you perform it? What kind of methods do you use to see what the brainwave is really looking like?
Well, we actually record the brain waves in a number of different areas in the brain. Of course, we take into account what the symptoms are, but it kind of gives us a clue as to where we might find the problem in the brain because, as I said, the brain, different parts of the brain regulate different functions and behaviors. But we look at the entire brain in an initial evaluation, and it's important that the two hemispheres of the brain are working together. And that's a big consideration in the evaluation. So we look at the left and the right and the front and the back and the top and the bottom of the brain. So we have a very comprehensive view of how those firing patterns are working throughout the entire brain.
So the method that you use, could you describe a little bit about the electrodes and how you and the program that you use?
Sure. We use an all-digital real-time machine that collects 250,000 samples per second. That's a lot of samples. And so that enables us to get a good amount of data so that the brainwaves can be reproduced just as they occurred. And we put sensors, they are flat gold sensors against the scalp, held on with a conductive paste. There's nothing invasive, and there's nothing that goes in. We don't use any needles, and we don't use any current. And so nothing goes in. The sensors work a little bit like a microphone. They're listening to what the brain is doing and reporting it through the computer. And we can see the brain waves in real time on the screen. And if you use that for feedback, you're actually getting feedback in less than a millisecond, which is as fast as God made nerves to carry the signal. So it doesn't have to be any faster until the firing is faster.
So it's a fairly simple method of doing the brain wave. It doesn't hurt. It gives us a lot of information. So then after the evaluation, you can look and see where the problem areas are. Is that correct?
That's exactly right. Not only where the problem areas are, but what the problem areas are. Is the difficulty in the slow wave realm, or is the brain running too fast at that place? And so there's an optimum firing speed, and we help the brain restore that optimum firing speed by inhibiting the wrong one that's dominant.
A lot of people ask, well, when they're sitting in front of the computer screen doing the training program, do they have to do anything other than just watch their own brainwave?
A lot of people do ask that, and the answer is they don't. What they have to do is just pay attention to the signal, because what they're doing by looking at the screen is allowing their brain to use information coming in from the brain's eyes. And so you have to look at the signal in order to enable the brain to see what's happening. The device that you're looking at, which is a computer screen, is a little bit like an electronic mirror. It's like the brain is looking at its own activity in the mirror for the first time. And once the brain sees what it's doing, it's amazing how quickly it begins to change it.
So when people are doing neurofeedback training, looking at their own brainwave on the computer, and over a period of time, changes take place in the brain. Now, these changes, of course, are to help facilitate a more optimal functioning of the brain. Are these changes permanent?
Oh, yes.
Okay.
And the reason they're permanent is because normal is the most stable state there is. One of the things the brain does for us throughout our lifetime is to heal us from various things. If we get sick and we don't die, we usually get well. And the same thing occurs when we have an injury. And when we return to normal, just like any other bit of damage or injury we have, when we return to normal, it doesn't come back unless we get injured again. And the same thing is true of the brainwaves. Once they are reestablished in a normal way, that's the most stable state there is. So it stays that way until something else happens that causes it to change. There was a study done looking at people who had completed neurofeedback 12 years prior, and over 90% of them still had very good brainwaves. As a matter of fact, sometimes a little bit better than when they finished neurofeedback, because after a number of neurofeedback sessions, the brain is kind of on a path, and it'll continue on that path. We call it a log burning effect for some months after the neurofeedback is finished.
Oh, that's very, very interesting. So would you say that, when we go to doctors, we get blood tests, we get our urine tested. Sometimes as we get older, we get an electrocardiogram measuring the electrical activity of our heart. Would you recommend that people should also know what their brain waves look like?
Absolutely. I even think it's important to have a baseline when you're younger and healthier, because if you have an injury or a change in your brain, you can see exactly how it was before and exactly how it's changed. I think that we should have brainwaves on file just like we have heart tests on file.
So that's part of a preventative treatment program for people then, would it not be?
It sure would be. Plus, you can begin to pick up changes in the brain early. The brain is changeable, or we call it plastic, throughout one's lifetime, but it changes more readily when the brain is younger. So if we can catch changes quicker when an individual is younger, we can probably remediate them faster.
Well, that's wonderful, wonderful. What is maybe 2 or 3 of the most common problems that present to you for neurofeedback evaluation and training?
Well, it depends on the age population you're talking about. If you're talking about children, teenagers, people of school age, the most common diagnosis that people present is attention deficit disorder or attention deficit hyperactivity disorder. And in that condition, we find that a lot of times it's misdiagnosed because all of the symptoms of attention deficit disorder are regulated by the frontal lobe. And the frontal lobe can be damaged or changed by 6 or 7 different things aside from attention deficit disorder. So by looking at the brain waves, you can tell whether the diagnosis of attention deficit disorder is correct. And when it is, then the medication is likely to work. But if the changes in the frontal lobe are caused by something else, say an injury at birth or a near drowning or a fall or a concussion, then you can have the same symptoms and not have the disease of attention deficit disorder, in which case the medications are not likely to help, but an individual is likely to have significant side effects from those medications. So attention deficit disorder is probably the most diagnosed condition we see in children. In people over about 50 or so, probably the most diagnosed condition that we see is Alzheimer's. And again, you know, there are 8 different dementias, and you can't distinguish which dementia you're dealing with unless you actually look at the brain waves. And some of the dementias you can actually improve. Alzheimer's you can't, of course, but many people are sort of stuck with an Alzheimer's diagnosis and suffering all of the psychological issues that come up when a family member is diagnosed. And younger people in the family begin to worry about their own future health. But if the dementia is due to something else, like an old head injury, for example, and that can be remediated, and the family members don't need to worry so much.
Oh, that's very true. Well, Dr. Montgomery, we're just about out of time today, and I thank you so much for visiting with our audience. If you've become curious about this neurofeedback evaluation and training, we'd love to have an opportunity to talk to you. So give us a call at 303-986-0492, and you can talk to Dr. Montgomery or myself. I'm Dr. Wanda Bedinghaus, and we will be able to make an appointment and get you started on, first of all, finding out what's going on in your brain and how we can help you. Thank you.
Thank you.